I'd like to sort of get the lay of the land if I could. What is the latest situation inside your ICUs?
Well, I'm not an ICU physician, but certainly they are busy. Numbers are climbing every day, and certainly everyone's doing their best to distribute patients amongst different ICUs in Ontario,
Yes.
so that one ICU is not more overburdened than any of the others. And we're looking to increase capacity as much as we possibly can.
And we've been talking about the strain that all of this has placed on the system. And last week, Dr. O'Connor, I was speaking with a doctor from Ottawa who has been involved in the province drawing up its triage protocol, should it reach the point where they would have to decide which patient gets life-saving care and which does not. And it's interesting that I know that's not something that you are involved in, the actual writing of all of these things, but your hospitals are already getting ready for that worst case eventuality. Tell us about the planning and the training that's happening.
So we're really hoping for the best, but preparing for the worst. And by preparing for the worst, what we're doing is making sure that staff are aware of the protocols and the tools that would be used. And we, in our emergency departments, so our simulation team, headed by Dr. Nadia Faruqi and Dr. George Mastoras, developed a series of virtual simulation cases. So 5 cases that are likely presentations to the emergency department. And basically how this worked is people would get the materials, and then we ran 2-hour sessions on how to deliver this news and how to talk to families and patients about the triage protocols, knowing that this is going to be traumatic both for patients and families and also their providers. And we wanted to do this in the best way possible, the most compassionate and empathetic way possible. And we thought really the only way we could do that is by training our staff and getting them comfortable with the language that would need to be used.
So we were looking at images there. Just to be clear for our viewers, those were not actual visuals of the simulations, because I know you have privacy concerns around all of those. But all of this is chiefly in terms of how there would be interacting with the families. What are you trying to do? What is the aim in delivering such horrific news to families?
Well, if the triage protocol is something that's put in place, we are going to need to tell families that in ordinary circumstances we would have offered ICU care, but because of the situation that we're in, unfortunately, we're not able to offer it to them or their family members, which is really a horrific thing and not something that any of us would want to do. And so, we don't want people to be stumbling over the words or making the conversation awkward and uncomfortable more than it already is going to be, but to allow people to practice using clear and simple language so that it's clear to families and patients what is happening, and in order to have people to practice how to respond to the anger that's inevitably going to happen.
So as you've run these scenarios, 5 of them, and the simulations, how have they gone?
So they've been well received. We actually are publishing a study on comfort levels and retention of the material, so with before and after tests. We are academics after all. But the most important thing that people learned was, some of the language, small things that can be said that provide some relief. And even more importantly, staff really were able to come to terms with how they were going to feel while delivering this news. This is, it's going to be very difficult on staff, certainly emotionally, and this allowed people to talk about what they were feeling and how this was going to be a big
Right.
burden on them. And the hope is that preparation will help.
Well, that was what I was getting to in that question, because even though it's a simulation, I mean, simulations are very realistic. So they would feel the emotion of what they would have to potentially encounter. And was it difficult for the members of the team going through this exercise?
It was. We created a safe space and allowed people to step away if they needed to. And some people did have to step away and turn off their cameras and turn off their mics. We have had staff members who have had family members who have been ill or recent deaths in the last year. And certainly our grieving process has changed a lot. And so it brought up a lot of those emotions for people as well. And so it was really a very emotionally charged atmosphere. But we tried to allow the space for people to feel those emotions and to talk about it with their colleagues.
How do you feel about your doctors, your hospitals, having to contemplate and run scenarios for situations like this?
I'm worried, of course. I'm worried about having to enact this protocol. I'm worried about the emotional toll it will take on our staff. And, you know, I'm worried about the eroding of that trust relationship we as medical professionals have with our patients.
Yes. Well, may it not come to that. I know these measures are really trying to avoid the worst case scenarios and trying to free up as much space as possible so you don't have to have this for real. I'm wondering if these images that we've been showing this morning will bring them back in, of a team in Newfoundland and Labrador, is bringing perhaps a little bit of a smile to your face, because I know it's just 9 nurses, a nurse practitioner, and 3 doctors, but there are people coming to help and try to make sure you don't have to get into that worst case scenario. What are your thoughts, Dr. O'Connor, on the military response coming and the team from Newfoundland on the way today?
Certainly, they are most welcome. You know, we're happy to have any help, and we do really appreciate our colleagues from the East Coast coming to help us.
Where do you see them being of most assistance?
Likely in the ICUs. That seems to be the place where there's the most burden at the moment. I don't know what their particular training is. It's my understanding that they are ICU trained, and so that's likely, I assume, where they would be deployed.
Dr. O'Connor, thank you for the time today. We'll stay in touch and really appreciate your sharing what's happening in your hospitals in the University Health Network. Dr. Erin O'Connor this morning.